Well, Ayla, it is a pleasure to have you on Worth Wellness TV. I've been looking forward to this all week. I'm so excited that you said yes to chatting. So thanks for being here.
Of course. Thanks for having me.
Well, I am so glad that I found you and that Luke's story pointed me your direction. So can you talk a little bit about how you got into birth work? And you call yourself a doula and a birth keeper. And I'd love for you to kind of help our audience get a feel for what that means to you.
Yeah, so I started doing birth work. Let's see, I started doing birth photography about 10 years ago. And then as I was in that space documenting birth, I decided to do a doula training with DONA, the Doulas of North America Association, which is actually an international organization. And around that time, I was also pregnant and about to give birth to my daughter. So I didn't really start formally holding space as a doula and supporting women until right after my daughter was born. And then I did lactation training. So I started working with women postpartum with breastfeeding. And yeah, it all just started blossoming from there. Shortly after, I did an intensive on placentophagy, the preparation of the placenta. And yeah, just in every direction I would turn, there was this opportunity to go more profoundly into this field with women, and I just would take the opportunity. And what was really driving that was my experience as a mother, because it was so consistent and coherent for me. Like I would just wear my daughter, my newborn, and like take her to wherever I was going, and she was so integrated into this experience. And in birth work, it's the kind of industry, I would say, where your child is always welcome. And like when I teach classes and when I did a lot more in-person work, people would always like really like shyly ask if they could bring their children. And I'm like, of course, like, but I recognize that we live in a world where it's like, otherwise it's like taboo or inconvenient or frowned upon, and so it was all flowing together really beautifully. And and now I'm at the point where, yes, I still use the word doula because for most people, that word is accessible, and most people have heard the word, right? And they know that it somehow is related to natural birth, right? People aren't quite sure what it means, but it's a gateway, and birth keeper, for me specifically, because it's not really an official term. There are just groups of women who have decided to define it, right, in recent years. And what it means for me is someone who holds space, right? Someone who in the birth space, they can offer support and guidance. I would even say someone working in postpartum is a birth keeper. I would say someone who chooses to offer any kind of support along the way is a birth keeper. Maybe someone who has some midwifery training and decides that they want to do a birth, right? Just hold space for the birth, but they're not a certified midwife or licensed or whatever. They can come in as a birth keeper, not assuming any responsibility for the experience, just holding the space for the woman and the family. The training that I offer right now to women, I just say it's a doula and birth keeper training. It's whatever you want it to be, right? We're just talking about birth and what it means to hold space. So you can just come in and define yourself however you'd like. So I don't know if that makes sense, but it's an unregulated industry. When people ask for like a doula certification, it's like there is no governing body. There is no one deciding that you can or can't do something based on your certification. There are organizations that try to make a living off of convincing us that we need to be certified in order to hold space. And so, yeah, I give a certification out basically saying you've completed this intensive training and now you can go forth and as a sovereign being, decide how you want to hold space for people in this birthing process and postpartum process. And so one of my students decided to be a doula for miscarriages. Another one just works with women postpartum, like right after the birth. Some don't attend births, some just do one-on-one prenatal support. So it's like, you have to find your way, and it's not always attending a birth,
It's so interesting how your own experience in pregnancy, as you talked about, sometimes I know for me, it's gotten me really interested in the world of birth, and there is so much there. And I really appreciate how well you do educate people on, just for the things that I've listened to, on interventions and what actually happens during birth, and where things, some of the procedures and things that we have thought are normal, really haven't actually been around that long and are not necessarily benign either. So I found that super helpful to give me, maybe intuitively, I felt uncomfortable about a certain procedure or intervention, but now I think it really is empowering to have that information too, of where did this even start and what was the purpose? And oh, wow, okay, that makes sense why I felt hesitant about that. So I thought we could go into starting with pregnancy. What are some of those common interventions that we've been told are just benign, but maybe they are actually not so much?
Yeah, I mean, one of the most common interventions is this belief system that we're supposed to be going to these regular appointments. Like, and I was with a client yesterday, and she was like, she's like, I get filled with annoyance and resentment knowing that I have to go in every week. For what? She's like, I drive for 45 minutes, I wait for 30 minutes, I'm seen for 10 minutes, and then I have to get back in the car, and like no information is really given to me. And so it's like this compulsory attendance, like that for me is an intervention. I mean, it's literally intervening with her nervous system and her time and her peace. And somehow we've been led to believe that it's part of having a normal, natural, healthy pregnancy, and that it's like the responsible thing to do. And then if you don't go, like you're somehow being cavalier and like disregarding the safety of your baby. So for me, these regular appointments are, BS, unless there's like some sort of high risk situation that's being managed, or some other health factors that need to be monitored, and in which case, you're seeing a specialist and doing whatever it is you're doing. So that's really common. And it also keeps us in a position where we believe that someone else knows more about our body than we do. And so it keeps the woman in this position of feeling helpless. She believes she's autonomous. She believes she's sovereign and empowered, yet she continues to participate in this like process she doesn't actually believe in or understand. And she could listen to her baby on her own at home. However, she's been told that she's supposed to go to an office, get in the elevator, sit on this chair, and wait for someone to tell her that her baby sounds okay. So it's a really common intervention, the prenatal appointments. And then apart from that, like the ultrasounds that, the regular ultrasounds that happen. If a woman is like older than 35, she's told that she needs to see, specialist, like getting more regular ultrasounds, just like kind of keeping an eye on things. And like suddenly, like the day after her 35th birthday, she's like, a threat to her own body. So that's interesting. And we don't question it. We're just like, oh, this is what I'm being told to do. That's common. The glucose screening, women can test their own blood sugar if they would like. If women are truly in touch with their body, they can actually access the sensations of what it is when they consume certain foods. And, it's an opportunity to become more intuitive about how we're nourishing our body. The GBS, the strep bacteria testing, that's something that's really common in the US, and women do it in the third trimester. And, it's a bacteria that exists inside all of us, men and women. And we're told that if you test with certain levels that are above average, you're infected, and that you have to receive antibiotics during your labor, which is typically 4 bags of penicillin throughout the course of your labor. And then if you don't do it during your labor, like you could get CPS, Child Protective Services called on you, and then they like strong arm you until then you give the baby antibiotics directly, right? Like the statistics, I was looking at them last night actually for a client who's being bullied at the moment by her doctor. To get the test done because she doesn't want to do the test, because she said to the doctor, she said, they don't test for this in Nicaragua, and there are no deaths. There are no babies dying of GBS infection. So she said something along the lines of like, if we don't test for it, does the disease even exist? And that's a totally valid question. And so she said that to her doctor, and they got really upset. And so I was just pulling together some statistics for her. And, you have every right to decline a procedure or a test. It's just, are you willing to deal with the backlash, which is that your doctor might drop you from their practice, You might lose love, right? You might lose approval from the person that you've been parentifying and aggrandizing and putting on a pedestal. Like that's really deeply scary for a lot of women to feel like they've been bad. I've been a bad girl. He's displeased. She's displeased. I chose myself and now I'm being rejected. It's like, so the wound-ology that comes into play during pregnancy and these prenatal appointments and in these dynamics with our care providers is really fascinating.
Whoa, there's a lot I've experienced and felt just from what you shared. And the appointment one, honestly, even with a midwife that I was seeing for the majority of my pregnancy, I get this text message, we're going along just fine. And I was kind of going more as needed, not necessarily all the scheduled visits. But as it got closer, she was like, you do realize in order for me to attend she didn't use that exactly, but it was insinuated, like, in order for me to be at your birth, you must come to every single visit. Well, I have a very low risk pregnancy. I love to study this stuff on my own. Like, I feel very knowledgeable and I don't have any questions. I mean, I would go to these appointments and really not learn anything at all. Even that was a midwife. That wasn't even just like a 10-minute appointment. And so it felt really weird to me because there's this level of also, as a first-time parent, you want to feel like you're doing everything you can to give your baby the best start. And it almost is like, okay, now I'm second guessing myself. Am I being irresponsible if I don't follow the mandated schedule to have this midwife at my birth, even though there's no problems, like everything is super smooth. I don't have any questions. Like, it's just really interesting. And I think that for me was kind of the hurdle too, of like, oh, wow, like, am I actually being irresponsible not doing this? Or, if I felt like I needed it, I would. Like, I don't know. I think that it's a really interesting thing. Like you said, the visit schedule and even the other tests and procedures as well. I did opt for testing my own blood glucose levels just with the little prick thing at home. And I was finding, because I've actually worn a CGM before and I've done before pregnancy keto and all those different things. And so I felt like I knew how to regulate my blood sugar really well, but the anxiety of testing like was stressing me out. Like, as I would go to do it, I was like, I feel like I have this like anxiety just because what if my number's too high? And like, so I actually, after I did it a couple of times, like realized, okay, it's fine. Like, I'm not out of the normal ranges. I'm like, I'm not going to do this the full 2 weeks because it's giving me so much anxiety just to test this. So I don't know. I just kind of tuned in and listened to that. I was like, I know I eat super well and like, and eat in a way that I would have balanced blood sugar. So I don't need to worry about it.
Yeah. And we also have to recognize that these midwives they're so heavily regulated by the state as well, like on a state and federal level, that like one thing goes wrong and they could lose their license and they can never work again. With doctors, they pay, a fortune for malpractice insurance. So they could literally commit homicide at a birth and they're covered, so it's difficult for midwives. They're really trying to like straddle two worlds. I've seen that myself, just with my colleagues, and it's a tough spot to be in. And I think like what you experienced is why a lot of women end up going into free birth situations, because they're like, what's holding me back from just doing this intuitively? If I have to deal with this constant bumping up against a midwife who's being so heavily regulated. And there are midwives here, for example, they just have paperwork saying, client declined test, client declined ultrasound. And, there's a way to keep yourself protected. But at the same time, if you're the type of woman who's going into your midwifery appointment and you're saying no to everything, then why are you even there?
Mm-hmm. Right.
Like, leave the poor woman alone. Stop, leave her, she's just trying to do her job and you're just in there being like, no, and no, and no. And it's like, well, then what's your issue that you feel like you have to be there?
Oh, that's a really interesting question. I think that is kind of honestly what led me into the more the free birth world, because it's like, if I don't want any of these interventions, like, why am I still participating in a system that wants you to participate in the interventions? So, which I think there's a whole nother hurdle in exploring free birth as well, because you've got, is your partner supportive of that? You've got friends and family who are, telling you you're being irresponsible and dangerous and all of that. And so there's that people pleaser, I think, in a lot, in me, and I think is not uncommon for women to feel like everybody needs to be okay with how they want to birth in order for it to be okay, is really tricky. And like kind of balancing that, like, ultimately, at least I believe, and I don't know what your view on this is, like, I really think it is up to the woman and how she feels like she's going to be able to enter into that birth experience and feel calm and ready and empowered and all of that. Like, I think that's really the most important thing, is the environment she needs to be able to feel like she can show up to this in an empowered way.
Yeah. So yeah, I agree with that. And, I am no one to tell a woman where she should be birthing or not birthing, but there have been times where I've been approached by women who are like, I'm doing a home birth. And from my own perspective as a witness, I can assess that they're not actually able. Like, everyone could be able, but there is a lot of work to be done before they could actually surrender to what that means. And I see them actually as a suitable match for a hospital birth, because I see them really ingrained in a belief system that the hospital is actually there to save and support them. And so as much as they might say they want a home birth and they're doing all the things, there is a belief system that's so ingrained that it's not my responsibility to dismantle that, right? I can offer my classes, I can offer my support, but at the end of the day, like, it's almost like a transfer to the hospital at their birth is imminent, because I mean, that's like a whole other, can of worms, but it's not about, and the woman should be honest with herself. And sometimes she's not, and then I also get the clients who are like saying no to everything at their, conventional OB hospital experience. And I'm like, you really are a great candidate to even free birth this or do this at your house. Like, why are you here? And then they just kind of need to break through one thing, which is maybe coherence with their partner's wishes, and like kind of getting the partner into the fold. And then once that is unlocked, then like they can fall into the home birth setting, so that's why this care and this space holding is so important. It's so individualized, because there is a whole psycho-spiritual minefield that we're working with. It's, and a lot of people are just like focusing on like the prenatal vitamins and the diet and like their birth plan, and then doing this at home and getting the tub, it's like they're keeping it very surface rather than looking at this as an opportunity to go really deep into the web of their family, their belief systems, what they wish to have in the future, where they've been, their dynamic with their partner. Like, this is really what can come up during pregnancy and birth. And you can either open the door or keep it closed and then see what happens, but I recommend like digging it up.
Yeah. I think there's a component, at least energetically, I found to pregnancy that kind of stirs it up for you. And then you can decide what you want to do with it, like try to push it back down or go there. And I think that as overwhelming as that can be, and has been for me sometimes, I've heard again and again, which is, I think, a little bit what you're alluding to from other practitioners in the field, like a postpartum pelvic floor therapist I had interviewed a while back, was talking about her experience of she wanted a home birth, all of that. And she's like, I ended up having to transfer because I was not emotionally prepared for what came up. Like, she's like, it really was not a physical issue, like with the baby or anything. It was like, I did not have the emotional stamina and I hadn't done the work. And she was really honest about that. And I thought, okay, wow. Yeah, there's more to it than just getting your supplies ready. Like, absolutely. And so I think that work is like super, super important. And if you're willing to go there, I think you probably have a better chance of not having a transfer if you're willing to beforehand really prepare for what that might be, or at least, I mean, it's hard to know exactly what might come up, but I think if we really take the time to to reflect and meditate, like I think things will surface. I know they have for me, whether that's childhood stuff or relationship stuff. It's been my pregnancy catalyst for my husband and I to work out things that have not been discussed in 3 years, like since we got married. And that's, I think if it's going to prepare us to birth together better as a result, for sure.
Yeah. Yeah. And I'll just drop this in here. I really believe that we are a match for what we actually want and know how to handle. There's a great book by Carolyn Elliott called As Extensional Kink. And it's this idea that we are kinking out on certain struggles or certain challenges, right? And I have had clients who really like fighting the system. That's like, it's how their nervous system knows how to be. And that's how their nervous system actually feels regulated, is by being in this struggle. And so I've seen, like, I should do a case study on this, but it's like, there's a belief system that like someone is going to come after them and challenge them. And they end up in the hospital, in the very system that they're like saying that they're trying to get away from, but it's almost like know how to be in a dynamic where everything just actually works out and is supporting them. They only know how to be in a dynamic where they're having to fight for themselves. And so I encourage everyone to look at that. Like, I really do believe like we're in this big cauldron of kink, and we can alchemize that. Like, where are we creating challenges and struggles in our life, and why are they chronic? It's not because we have bad luck or God is punishing us. We are literally co-creating that all the time so that our nervous system feels like it has a role and it feels safe, because we've been doing this for some reason since we're children, right? And people are like, wow, are you saying that I manifested the birth that I had? It was such a traumatic birth. And I'm like, well, I would be open to assuming responsibility for it, as much as we want to vilify and blame the hospital, blame the doctor, blame the midwife, blame the doula. If we're tapping into our instincts, if we're really clear on what we want, if we're recognizing where we create challenges on purpose so that we perpetuate victim consciousness, if we're really doing that work, then we're not going to end up in situations that perpetuate the victim consciousness. And that's a hard pill to swallow.
Oh, yeah. I think actually that concept I first heard in Kelly Brogan's community, where she talked about, like, are you addicted to struggle? And I mean, it's like the minute the words came out, I was like, oh, shoot. Like, yeah, that's me. That has definitely been me. And I think, there's stuff rooted in childhood and like living in a chaotic home environment for so long, you kind of that's what feels normal, like, is to always be struggling and stressed and like all of these things. And so I also heard Yolanda Clark talk about, if we're really addicted to drama in our lives, we could have a very drama-filled birth, like, because that's what's normal for us. And I was like, wow, okay. So, here I am in week 33, if you count the weeks of, all of that. But I'm thinking about that, like, okay, how can what does it look like to actually start to think about a birth where everything goes smoothly and it's peaceful and calm and ecstatic and nothing is going wrong and nothing's dramatic, And so I'm just curious, do you have any ways that you help women prepare, if you start to, in your consulting, start to see that there is that pattern and they really want to have this, they say they really want to have this peaceful, maybe orgasmic birth, but you can see signs that they're kind of living in this addiction to drama struggle. What steps would you give them in order to start to move towards what they actually desire becoming a reality?
Yeah, I encourage them. I mean, we do this in my class, but just one-on-one, to access their limiting beliefs around a certain experience, and then start to unpack that and reframe that. Why is this my belief system? And then what would it mean for, let's say her name is, I don't know, Amy. What would it mean for Amy if she had an uneventful, peaceful birth? What would that mean for her? It might mean that the people in her family were wrong about her being irresponsible for doing the home birth. It might mean that she doesn't have anything to complain about after her birth. It might mean that Amy only gets to celebrate her new baby and she doesn't get to commiserate with her girlfriends about how hard breastfeeding is. So those are all the things it would mean for Amy if her birth just went uneventfully and peacefully. And does Amy know how to do that? Does Amy know how to not be a victim of her family's criticism? Does she get off on being criticized by her family because it perpetuates the victim consciousness that Amy's irresponsible and like the weird one, the black sheep who's always doing things differently from her conventional family? It would mean that Amy has a new identity in her family constellation. Can she handle that? Right? So I just ask people what it would mean if things went the best way possible, and what would they have to do and how would they have to restructure, and could their nervous system handle not being in victim consciousness?
And if the answer is no, what then do they do?
I'm like, I don't know, guys, session's over. No, I'm just kidding. Yeah, you know, and then they can take the time to work through that. It might, you know, they might need to go back to why it feels safe to be in that identity space, the irresponsible one in the family, the crazy girl who always does the alternative things. Like, how has that identity served her? And does she want to bring that to her child now? You know, does that serve her as a mother, right? And would it mean that she has to make new friends who actually like breastfeeding and feel that it's easy, and not be around friends who all complain about breastfeeding and how hard it is to be a mom, and we can't do it all and society expects us to do it all? And, you know, what would it mean for her to not go into that field? And what would it mean for her to be like, I love being a stay-at-home mom and I love being taken care of by my partner, and I'm not doing shit for 3 years except taking care of this baby? What would it mean for her to not have an identity that she's so used to having? So it's all just more questions and more questions, and the woman gets to decide how deep she wants to go, and she might find something there. You know, we open things up, and, you know, I can give people tools, but really take it to where you can handle it, you know, titrate into it, and just start repatterning. That's all we can do. And be in open communication with your partner, because they might be going through some things as well, right? They might be kinking out on something where they're like, oh, you know, my family thinks I'm irresponsible. You know, they might have their own kind of like tandem experience.
That's so rich what you shared. So thank you for being so generous with giving that insight, because I think that is the deeper work of pregnancy. That is the stuff that is going to carry on into your mothering. Like, really, if you don't address it, like, it's just going to keep going. The birth is maybe, you know, 1 to 3 to however many days, but then you've got the rest of everything else. And so these things like going here really will serve you into your mothering as well. And I think it's good to think beyond just this one day event. Which I think sometimes, like you said, we can get so focused on that and realize like there's a lot more going on here if we're willing to I feel like the babies, I don't know, I just feel so thankful for how my baby has like directed me to go to these places and make me a better human. And I think like do that like for yourself. Like that's just such a beautiful opportunity that we're afforded as this like
yeah. And people say, oh, this is what you're talking about is just for like really resourced women who have privilege and the time to do this work. I don't have any time. I make time. I prioritize. I mean, I'm a single mother who works full time, and, you know, like I still make the time for this type of work, for this expansion. For me, it's just as important as eating every day and drinking water, you know? So anything is possible. Creating time for this is possible, no matter where you are in life for a degree of privilege. It's a matter of prioritizing, and many people don't want to. It's uncomfortable to do this, and so they'll make a lot of excuses. right? This could be a 10-minute practice where you simply journal about what you're resisting. You journal about what it would mean to be a woman who has a peaceful birth. It takes 10 minutes. This is not like a program that it costs $5,000 in Costa Rica. Like, this is literally something you do from your home in a journal, in reflection, in prayer, and you just start peeling it back bit by bit,
Mm. Yeah. And I mean, that's the stuff, like, no one can do it for you. Like, it is your responsibility. You've got, yeah. And I think that's like very sobering to realize, like, if I want this to change, like, it's going to be me. And that's actually all we really have control over anyways, is like where we decide to go in our own development and consciousness. So
yeah,
I think
these babies are mirrors. I mean,
they are.
yes, we're expanding our family. Yes, like, this is about community and love and sharing experience, but really what we're doing is we are committing to having a mirror that's reflecting so much back to us. That's what this baby really represents. And it's an opportunity to heal your lineage, heal yourself, for your partner to do the same thing. But a lot of people don't look at it that way. We've really accessorized babies and are really, in a place of unconscious conception and unconscious family planning and expansion. So,
which reminds me, one of the books I'm loving right now, Dr. Shivali is The Conscious Parent and The Awakened Family. I can't remember all her books she has, but I'm reading The Conscious Parent, and like, I have a stepson who's 6. And so some of the stuff totally comes up all the time anyways. It feels very different, like now carrying my own child, but realizing that, like, they are there to show you all the ways you're asleep and unconscious, and like how triggering that can be, but realize what a gift that is. Like, and so, yeah, I think that's, I just like acknowledging that and being willing to dive into that is going to lead to, so for me and my stepson, because it's been such a rocky road for us, so much more harmony when I see anytime I'm triggered as an opportunity to become more conscious, and not him trying to make me, frustrated or like irritated or whatever. So yeah, I love all of this. I love going into more of the spiritual, emotional side of bringing children into the world. And I would love for you as well, though, that something I think is equally as valuable when we talk about birth is this whole idea of physiological birth. And it's not a term I'd really heard of before I dove into this in my own pregnancy, but understanding that there is a setting and conditions that make the process of birth unfold more smoothly than often, I think, what's painted for us in the media and movies, and even often in the hospital setting. And what are those factors that lead to a physiological birth unfolding smoothly that you find are really important to educate people on?
Yeah, I mean, at the end of the day, we're animals. And so if we feel safe, we're at ease, physiological processes can unfold more smoothly. If we don't feel safe, we're in survival, then we kink natural processes. So that's really what it comes down to. And often animals, right, if we watch them in the wild giving birth, they'll find a space that is secure, free of predators. If a predator comes into view, the mother who's laboring, birthing, will take note. The adrenaline will surge through her body. Her contractions will stop until she's able to access a safe spot, and then her labor can continue to move forward. So if we just look at that basic model, and then look at how women are birthing in hospitals, right? I've seen many times where a woman is laboring at home, everything's moving very smoothly, unfolding in the right time, or whatever that means. And then she gets to the hospital and everything halts, she stops, she's not dilating anymore. Her contractions have spaced out, her eyes are kind of darting around. Maybe she has like an unsavory interaction with a nurse. You're stepping into a whole field, into a whole environment. And then because her labor has plateaued, she's, given the recommendation to receive Pitocin, or something to augment the labor and strengthen the contractions and make them more intense and like get her back on track. And then she receives the Pitocin, right? Because she wants to get back on track. And then that's incredibly painful and uncomfortable because it's unnatural. Yes, it is synthetic oxytocin, right? However, it is doing something to the body that the body normally wouldn't do in a normal physiological birth. It's fake. And so then she feels stressed, the baby gets stressed, the heart of the baby's getting monitored because the Pitocin is creating this kind of discord in the process. And then the woman wants an epidural or some sort of pain relief because it's just too intense for her to handle. Next thing she knows, she's hooked up left and right. And that is not normal physiological birth. Now it's highly medicated, highly controlled birth. And so when we look at environment, it's like, where are you going to feel the most at ease, right? And if people say I'm going to feel the most at ease with technology and doctors and nurses and people watching my every move and every step, then I don't know, that's your bag, you know, that's your deal. And maybe that's true for you. However, we have such a disconnection between our body, like the mind and the body are just like here, and it's so disparate. And so we are moving forward only with the mind. It's very cerebral. And so we say, yeah, I'm safer at the hospital. I have the monitors, I have the technology, and we're completely overriding what the system is actually telling us, which is like, I feel safe at home. I just want it to be my partner and like my doula and my mom. And like, that's actually what feels good. And we're like, nope, that's not wrong. That's not right. That's wrong. We need to go where we're actually safe, intellectually safe, in a place that is highly controlled. So yeah, it's important to really feel into where you feel the safest, where you believe yourself to be the safest, and then kind of unpack that further.
Which makes me think of this quote that you posted recently on Instagram where you talked about, if you can make a baby, you can birth a baby. And I was like, we read that and we think that makes sense, but why is there such a disconnect with that? Like why? And it is, I totally think that from a very cognitive perspective, a lot of people are like, I think I'm more safe with, you know, surrounded by all these medical professionals, but birth isn't a medical emergency. So like maybe if you had an organ that's falling out of your body or something and this emergency care, then it makes sense. But that's not actually what birth is. So I think that's the other disconnect, is like we have so medicalized birth that I think leads to us thinking, well, if it's a medical event, we're safer around medical personnel, but it's not. So I think that too. So I'm just, well, go ahead.
Oh, that's how it's been set up, right? I mean, that's the training we get from the beginning, watching movies, you know, from youth, like, the woman's pregnant, she's uncomfortable, she's planning to go to the hospital, maybe her water breaks and it's like all over the floor, and then the panic ensues and they get in the car and it's like, we got to get there as soon as possible. There's no way the baby can be born at home. That's crazy. We need to get there. And so that's what we grow up seeing. And there's also no birth education in schools. Like we do biology and some reproductive education, but because reproductive education is so sexualized, we just like don't talk about birth, right? So it's like we're up against so much. Like, what do we expect? You know, we're not trained to listen to our bodies. Like I've even had clients come to me and they're like, oh, you know, is my placenta expanding? Like the baby's inside of the placenta, right? And I'm like, wow, you know, like you're like an educated woman and, you know, you manage a lot for a living and like you do, but like you are missing this one fundamental piece. Like, no, the placenta is an organ that your body created and your baby's inside of your uterus. And so that to me is so indicative that there is a huge void in women being connected to their bodies and understanding, like even how their ovulation works, for example. Like, where are my ovaries? What happens to my ovaries every month? You know, what does a pinch in my ovaries mean, you know, during my cycle? Like we are completely unaware because we've also just been medicated with synthetic birth control. When we get our period, you know, often our moms, unfortunately, are like, oh, you know, here's a tampon, here's a pad, like go to the bathroom, put it on. You know, welcome to adulthood, welcome to pain every month. You know, it's like it's not celebrated. We're not celebrated as creators of life. We're actually kind of put in a closet because we're so sexualized, and it's easier to look at us as sexual beings rather than creators of life. So yeah, it's intellectually we can understand that if you make a baby, you can birth a baby, but then on all these other levels, there's so much doubt around it because we doubt our own body's capabilities. Like, I know women who get upset every time they get their period. It's like an inconvenience, and like, I can't go do stuff now, and ew, and I have to spend money on, sanitary pads or whatever it is. And it's like, wow, there's such a self-rejection from the beginning. So how could we have any trust that we can actually birth when we don't even love our own bodies? It's like, yeah.
Yeah, I think it's interesting you brought up the whole menstrual cycle component as well, because in the world of fertility awareness, when I first was kind of introduced to it, when I came off hormonal birth control, when I dove into how to actually track your cycle based on tuning into your body and understanding all the signs and signals, I was like, how am I a woman in my mid-20s? And I had no idea about how my body worked. Like, I mean, that is so crazy. And I think birth is kind of the same way. And if you don't know how it works, I think it is a little bit more scary to do it in a way that's not heavily monitored, honestly. And I mean, I think the same thing with the birth control. A lot of women don't trust that they'd be able to accurately track their cycle and, prevent conception if that's what they want, using like tuning into their own body and using the signs and signals themselves. And so it's easier to just take birth control because it feels safer, like more guaranteed. But the statistics do not indicate that. It's someone who's well-trained in fertility awareness. It shows like 99.5 or something like that % accuracy. It's super high. And I think with birth, if that's how we kind of start as women with our menstrual cycles, it makes sense that we then go into birth kind of feeling the same way. Like, I can't actually do this by myself, and I don't know what's going on because we haven't received that education. That point too about we're not as teens, like in sex ed, like there's nothing about birth is really fascinating.
There's so much here, but the way that I've taught my daughter about, she's 6.5. So the way that she's learned about her body is through birth. So we watch birth videos. I explain, what happens when sperm and egg come together. This is what a man and a woman do. Like, it's completely de-eroticized. There's a natural, normal physiological process, right? And so she's starting to understand the capacity of her body, the power of her body, and the sanctity of it as well. And hopefully through this comes a deep sense of self-love. Hopefully this can be one of the tools that she uses to access self-love and self-worth, and in choosing partners, right? And a partner, and how she interacts, with her own body and celebrating it. Rather than like shoving it into a closet. There's so many women who are like, I'm pregnant, I'm a goddess. They want to skip the birth and then they want to get to the baby. It's almost like the part where their body actually goes through the like that pinnacle transformation, and the part that's messy and the part that requires the most surrender, they want to avoid it. It's like birth and death. They're kind of, those are the two things that are put in the closet. All of these natural, normal processes that make us confront ourselves, make us confront our belief systems, are like stored away. So, people often have, with 2 children, right? They don't tell the older siblings what's going on. They're like, oh, you're going to go to your grandma's house for a few days. And then they come back and there's like a new baby in the house, and they don't really understand.
Like, it just popped out of the mom's tummy. Okay.
It's like a stork dropped it off. It's like, are we still doing that? And so then we wonder why there's a disconnect between siblings. Sometimes we wonder why there's a disconnect between the mother and then that child, who's the older one. It's like, where's the trust is not there, but when you include them in the process, even if they're in the next room and they pop their head in to see what's going on, they are integrated into the family. They understand this is a result of what happens when 2 people come together and create life. This is birth, and it is normal, right? And that's the first opportunity we get to really show our children that birth is normal. And we stand a chance against the Hollywood indoctrination and the horrible science education that's given in schools surrounding birth and reproduction.
Yeah. Wow. It's such a big topic. I think that idea too, that I thought about a little bit, and our dynamic in my family is different with my son being a stepson and like our relationship level. But I have thought about that a lot, of just as we've gotten different things come for me in my postpartum period, like gifts from family, thinking about like, this is my moment to not pretend this item is for something it's not, and to really like in an age appropriate way try to explain it to him, whether that's like, organic cotton adult underwear or whatever it is that comes in. And he's there, and we've been like opening gifts as a family. And so I was like, if I make this more normal, like, it's not, like you said, it's just a process of life. And I think accurate education actually leads to treating women better. I really do think it does. So it's been interesting though, because I think we don't give kids credit for how smart they really are. So like it's almost like gaslighting, trying to pretend it's something else, because I can see he has his own idea. Like, I actually think that's for this, but he's afraid to say. So I think just like having those conversations and being really honest is really important for those kiddos that are around.
Totally. And I think it really emasculates the little boy ultimately, for him to be like completely, I don't know, I don't want to say protected, because I don't think it's protecting. I think the intention is to protect, but I think what's really happening, it's deception, that a woman doesn't go through these processes, that they one day won't be a part of this process as a masculine counterpart. Like, why would we rob them of that? That's also their gift. That's also part of their purpose on this earth, and so we're just going to not educate them about female bodies or their own body because we're trying to protect them from some sort of perversion, so we personally have to get really clear on like, what is perversion, and why do I feel that talking about the body is perverse and erotic only?
Yeah, that's a really interesting question. Yeah. I would love to go into, because I know you also help with lactation consulting and that postpartum kind of journey for women. I found it really interesting as I have been diving into some of the things that, the interviews and stuff, like I mentioned, how there are certain ways we go about postpartum that actually lead to making this process that's normal and natural, like breastfeeding, more difficult for ourselves, whether that's milk supply or things like that. And so I thought that was a really interesting thing to talk about, and would love for you to share a little bit more about the ways we're setting up our postpartum that might actually lead to complicating these normal processes, and what we can do to not complicate it.
Is this like a separate podcast episode? So I will say that the way we choose to birth, and yes, I'm using the word choose, the way that we choose to birth does affect what happens postpartum, and it does affect the field that we go into postpartum and our ability to breastfeed. Not to say that I have not worked with women who've had unplanned C-sections who end up successfully breastfeeding, but it has to be approached in a different way, and there has to be a lot of will and a lot of support to do it. Medicalized births often lead to a greater increase in women not breastfeeding. Part of that is due to the emotional and physical processing that has to happen after a medicalized birth, because it is traumatic for the body. Getting an epidural is traumatic for the body. Getting an episiotomy is traumatic for the body. Okay, getting a C-section is certainly traumatic for the body. Those are all assaults on the body, right? Getting a needle threaded into the dural space of your spine is an assault. Like, it's not dramatic, it's just fact. And so having to recover from that, not only from that, but the marathon of the actual birth, all of the hormones shifting, we then go straight into breastfeeding, right? The baby is out and now it's time to breastfeed. So there is no downtime to process this. So what are we doing during the pregnancy and in planning for our birth that's going to give us the most ease and opportunity to have a smoother transition into breastfeeding? How have we set ourselves up postpartum, like logistically, right? So many women are like, I'm going to go back to work after 6 weeks, or like, I'm working from home, so I'll be fine. Like, I'll just check my email once or twice a day while I'm breastfeeding after the birth. And I'm like, It's like we're delusional. We're delusional, and it's okay, you know, because society has set us up to believe that we're supposed to be doing all of these things, and that it's okay to leave your baby with a nanny. It's okay to leave your baby in daycare. It's okay to be working and doing all of these other things and being in our masculine, while we're supposed to just be nourishing our baby and recovering from the birth. We've been led to believe that that's okay and it's somehow acceptable. So then our partners also believe it, right?
Yeah.
How about we ask our partner, how about we make an arrangement with our partner or our family and say, I want to breastfeed at least 6 months. How are we all going to work together so that that happens? Right? Because it does not involve me going back to work and basically living two separate lives. You know, and some people say, well, I'm, you know, a single mom, I don't have any support. You know, there are certain instances where it becomes very challenging to access support in our society. Of course, that's very true. However, for the most part, I'd say like 85% of women can access support if they just ask for it, and if they just get real about what they can actually do and what they want to do, right? If you don't want to be at home, if the thought of being at home with your baby and breastfeeding feels absolutely horrible to you, then just set yourself up in a situation where you're not in conflict and you don't even attempt to breastfeed, you know. But don't attempt and then try to do 1,000 things and then say, oh, breastfeeding is really hard, it's impossible. Like, just don't even go there if you don't want to go there. But if you want to go there, you want to breastfeed, commit to it, and know that breastfeeding and being in postpartum is a full-time experience. It does not involve, you know, going to Pilates class 4 days a week postpartum, and it does not involve going back to work part-time. It does not involve working remotely from home. It can happen, but you're going to be very stressed out. You're going to be uncomfortable. Your hormones are going to be off. You're not going to be nourishing yourself properly. You're going to be exhausted, depleted, and you're going to become resentful. You know, and that's just the reality of it. We are not meant to be new mothers while also meeting all of these other demands. And so when we attempt to meet all the other demands, we suffer. And typically it's the baby that ends up suffering, and the mother's mental health and breastfeeding.
Goodness, yeah. I think a lot of it, from just kind of as I think about my own postpartum and what I've heard and seen, because we've normalized women just bouncing back and going back to work really quickly and all of that. I think even if you do try and decide, okay, I want to take, you know, a period of time off, like you said, I would like to not work for those 6 months that I am breastfeeding and all of that. I think there's this layer of guilt that that's not enough of a contribution to your family, to whatever, because I think as women, especially recently, and it's a very complex thing, the whole feminist, like, there's so many things with that. But when it comes to mothering, I think for myself, like, there's that, will I be doing enough if I'm at home just breastfeeding and caring for a baby and not doing things out in the world? Like, is that really enough? Or am I limiting my potential and not contributing to like the bottom line of our family and all of that? And having to work through that. I mean, I think if someone listening to that has those thoughts like I have had, like, do the work before the baby comes, have the conversations, really go there, like we were talking about earlier. But I think that that's a challenge. It really is, because maybe it's what we want, but we also feel that sense of guilt might overtake us and be like, okay, but I need to bounce back as quick as possible. And then we don't really give that gift to ourselves to really devote to growing and healing with this baby after the birth.
I mean, is it a sense of guilt, or is it that we don't know how to be in our feminine and we're so hyper masculinized that, I mean, for us to be like, I need to get back to my mission, like, that's a masculine thing.
Yeah.
There's nothing wrong with it. I mean, many women have a mission, because many women support themselves. Many women have been trained to believe that men are not safe, so we have to create safety for ourselves. Like, there's so many belief systems that we have which drive us into our masculine. And so, yeah, it's not like, oh, how am I not contributing? How is raising a baby and nourishing them and giving them the best experience possible not contributing to the family? Like, why are we in a space where like financial contribution is
Right.
more relevant and
Mm-hmm.
important than actually the health of the family and the balance of the family?
Yeah.
So those are all
Yeah.
things to think about. And look, this is not, it's whatever, triggering for many people, but it's like, it resonates with me as well. I went through those challenges postpartum, and it's a matter of creating plans, asking for help, getting on the same page as your partner. If you're with someone who's like, no, we're 50-50, everything's 50-50, you chose that partner. So, like, you're with someone who believes that. So then you have to rearrange and say, okay, if finances are 50-50, then I guess the mothering is 50-50, feeding is 50-50. How does that really work? And I know people who set themselves up that way. And hey, maybe that works for their family, but really mothers are the ones supposed to be feeding the baby. The first 2-3 years, the baby is in the mother's world. And biologically, that's how it is with animals. There's no role that the father plays or the masculine plays right after birth that's really in direct contact with the baby. The masculine is responsible for creating food, safety, and shelter for the woman to be able to do what she's meant to do, and thereafter the masculine starts to shift as the baby gets older, turns into a child, and needs to learn how to be out in the world. Then that's when their relationship starts to come into play in a different way. And I know that's really hard for a lot of people who've been, brainwashed by this feminist movement, to believe that like biology is BS and that we have, and it's like, it's a whole rabbit hole.
Yeah.
Yeah.
I don't know. For me, like, yes, I wanted to be contributing to the world and like starting my own business and all of that, but realizing that was a component, but I wanted to do it in a way that honored the feminine. And that's the part that just later I realized doing your mission in the way that's like super masculine is not fulfilling for me actually at all. Like, I want to know how to run a business where I'm moving from my feminine energy and honoring that, like my body, my family, it works around being the mother I want to be and all of that. And I think, yeah, I mean, that's kind of a different topic, but
yeah, it's nuanced. It's really nuanced.
It is.
It's not so black and white, but and people say, well, what if I can't be in my feminine because I'm not, the masculine doesn't know how to support me. And so it's like, there is a greater thing there, because also the masculine, they have their own challenges. They haven't been given the proper support and training and leadership to be in their masculine. So it's like the roles are reversed, and people get triggered and say, oh, well, this is so traditional, this is misogynistic. It's a whole line of inquiry. And this is something that if you have the opportunity to really resolve and find this beautiful polarity with your partner before you get pregnant, like, do it, and if you want to access that polarity while you're pregnant, do it, and sometimes we can't access it until after we have the baby because now we're aware of it. So it's always there for you to heal. Like, every masculine and feminine can heal that within them and start practicing things that will put them into a balanced polarity. And everyone starts to feel at ease. Everyone starts to feel purposeful. The harmony of the family is amplified. And sometimes we have to break down what's going on up here and all the things we're told that we're supposed to be doing, supposed to believe. And, history tells it, it's like, just worry about you and see what feels right for you.
Yeah, absolutely. Well, Ayla, I've loved chatting with you. I know it could go so long. There's so many other things, of course, we could dive into, but I'm wondering if there's anything we didn't touch on that you'd like to leave to viewers as a parting thought, and or also letting them know what you do offer and how they can connect and learn from what you share with the world.
Yeah, I have an online class called Uncovering Birth, and it's really for anyone. I mean, it is for, pregnant women and couples. It's also for practitioners, chiropractors, massage therapists who work with pregnant women or women postpartum, A lot of lactation counselors take the course because they want to understand, like what's led up to this point. Now that I have this client, she's breastfeeding, I need to understand the birth process. So, and it's just also for people who want to understand their own birth story. I mean, some of us, we don't even plan to have kids and we just want to know, like, what is this all about? How do we come onto this earth? So that's the class. It's really a beautiful offering, super powerful. And I'm also available one-on-one. So I do work with people on Zoom and, at any point in their journey, planning to conceive, already pregnant, years postpartum, and they're looking to process what happened at their birth 10 years ago. So yeah, I'm available for all of that. And it's been such a pleasure talking with you. I loved all of your questions.
Yeah, thank you. I think it's going to be really rich, so much for people to dive into, and hopefully, I mean, I know I'm going to come away and be like, okay, I have some journal exercises to work through now. So thank you. Thank you so much.
Like every day, all the time.
Yes. Alrighty. Well, you take care. I hope you have a beautiful rest of your day.
Likewise. Bye.